been talking about the president announcing the U.S. will have enough of the COVID vaccine for every adult in this country by the end of May. That's great. That's a pretty big deal. You know what else is a big deal? Dr. Jen Caudle. She's back with us. She is our medical expert, and she is joining us live right now. Dr. Jen, good morning to you.
Good morning.
You know what? A vaccine in every adult arm by the end of May. Merck and Johnson merging to make this happen. How big of a game changer was this announcement?
I think this is huge. And by the way, as a family physician, I am so excited about this. One of the things that I'm hearing from my patients, from my social media followers, and I know everyone out there feels is, when can I get a vaccine? How can I get a vaccine? The rollout has not been the smoothest, that's for sure. We've had issues with distribution, with quantities that have been available. And the idea that Americans will be able to have this just in a few months is certainly better than what was predicted before. Honestly, I'm excited about it.
Well, Dr. Jen, as excited as you are, your patients, all of us are, some people, it seems, are looking past this pandemic a little too early. Mississippi, Texas, lifting the mask mandates just universally. How does that affect the rest of us throughout the country?
Well, I'll be very honest with you. I don't think it's a good idea. I think that it's potentially, short-sighted and premature. That's at least my worry. We just crossed the milestone of losing 500,000 Americans in this country from COVID-19. Even though cases in the last few weeks have been on the decline, hospitalizations, deaths, etc., we've recently, in the last few days, started to plateau. That is concerning. And not only that, we now have these variants, which we know are more transmissible, and we're still literally trying to figure out how these variants play into the vaccines that we have. There are still too many unknowns, in my opinion. The CDC is calling for conservative measures, that we be thoughtful, mindful, and that we do not open too soon. I certainly feel the same. I think the idea of rolling back mask mandates and opening up 100%, I don't think it's time for that. I don't.
Yep. Yeah, we can see a spike and we can be right back to where we were this time last year, or even in the summertime last year, as the numbers had gone down and they started to go back up. But we got to look out from our frontline workers. And of course, you're one of those frontline workers. You and your colleagues, if you happen to work in a hospital in one of those states right now, Texas, Mississippi, how concerned would you be?
Very concerned. And I think that, as someone, I'm not in Texas, for example, not in some of the other states, but, honestly, I'm very concerned for my colleagues in those states. I'm very concerned for all of us, because as you mentioned, we've seen what's happened when we pull back in the past. It's not like this is the first time we've tried this. We've tried this 2, 3 times over the last year, where it seems like things are getting better. We get excited and then we sort of jump on this pulling back. Okay, let's open things up. Of course, I'm oversimplifying it, right? But we see that cases can go up when that happens. And we also see that cases tend to go down when we pull back. I am concerned about putting my colleagues and people, Americans, at risk by sort of opening up. Now, one thing I should say is that, we know that the country being shut down is tough on all of us. That is not an ideal situation. No one wants the country to be shut down, for our economy, for the livelihoods of families, for mental health, for so many different reasons. However, we have to be smart about this. And perhaps there are some activities that are maybe safer to open up than others. What I'm asking for is that we be mindful, thoughtful about this, that we follow the science, and that we do not do things prematurely, because as you mentioned, and as I feel, I'm concerned about us going back to where we've been before. And yes, certainly putting healthcare workers in those states back in jeopardy, and of course, patients as well.
Dr. Jen, we're almost out of time, but I do want to ask you this. Once we get a handle on this, I know your patients are probably also asking, when can we get back to normal? When will we forget about COVID? But the truth is, we may never be able to, and it could move from pandemic, and I want to make sure I get this right, to endemic, meaning it wouldn't go away, like the flu. Can you explain what life would be like?
Yeah, that's certainly, we're hearing more about that this may be a virus that we have to live with. The question is how we have to live with it, right? What we don't want to have to do is to continue living sort of in this pandemic state where we're losing thousands of people every day from the virus, that we're getting cases and cases, and that we're still at high levels. But by the way, I think it was mentioned that we do have case levels right now as what they were in the summertime. So once again, even though they've dropped, they've now plateaued. They are still at the level at the summertime, which is still too high. But to your point, we may have to sort of learn to live with this virus in our communities, in our lives in some ways. What does that mean? Well, I think there's a lot to learn about what that might mean. The question will be, will we need booster vaccines for the COVID vaccines that we're getting now? Will we need a yearly vaccine? All of these are questions that we don't know the answers to right now. Will this become something like the flu, as you mentioned? That's a really good question. The hope certainly is that we will not need to mask up, social distance, stay away from each other to the level that we are now. That's what we're trying to get out of. And that's why continuing social distancing at this point, wearing our masks, staying in our bubbles, washing hands, that's really important to get us out of this. But yes, we are certainly seeing a bit of a paradigm shift in our lifetimes, in our generation. Absolutely.
Well, we've
I
had a
think
lot of
all of us
those.
have to get ready for this new normal. Absolutely. Yeah. Do our due diligence to stay safe in the meantime. Dr. Jen Caudle, always great to see you. Thank you for joining us here on BNC this morning.
Thank you.